So Beth, look, in the way that Yvonne described, the importance of getting these measures refined is that we've got a clearer picture, and of course what we'd like is a perfect picture, and we're constantly looking to see whether we can modify and glean a more granular picture. The reality is, and I think when SAGE gave its evidence on its review of the social distancing measures around the 16th of April, I think, was the press conference, so it was shortly before then. They were very clear that the R level was coming down. It was below 1 in the community, but there were challenges in hospital settings. We're getting to grips with that, but also in care homes. So we've known about this challenge, and we're doing everything we can to meet it. PPE is one of the aspects of it. Testing is another. But probably the single biggest thing, and this is tough in a decentralised, localised set of care homes, is making sure that we control the ebb and flow of people into those care homes that may risk transmitting the virus. So alongside all of those other practical measures, disseminating that guidance, refining that guidance, supporting those care homes as best we can is the surest way that we will really get a grip and then drive down those infection levels in the care home scenario.
Clearly we have moved to a system of recording deaths that is better and more granular because it covers more than just the hospital setting. But in epidemiology terms, eventually we will be able to compute a different estimate of deaths called excess deaths. And that is really accepting that across the year, deaths go up in the winter and down in the summer in a broadly oscillating wave. And one can work out what the average is over multiple years and then work out what in this particular coronavirus pandemic our departure has been from that in terms of total number of deaths. And that will give us an excess death figure, and that will be highly comparable when other excess death figures come out across the world, including many parts of Europe. In time, we'll have a much better answer when we start to look at excess mortality as a total, which will take into account both deaths related to COVID-19 and deaths that may have occurred not due to COVID-19 at all, but as a consequence of the crisis. And some of those will take time to come.